everybody and welcome back. This is Dr. Mridula here. So of late, have you noticed that your kid blinks his or her eyes a little too frequently? Well, today I thought let me share with you why kids tend to do that and how we as parents could help them out and try to reduce that blinking. So in some kids it is quite normal. I mean, it is generally seen between that phase of 5 to 10 years. And it's a very temporary phase. It will be there for a while and after that it will naturally come down. It is generally not associated with any sort of an illness, but it can be seen in kids who are a little stressed out, anxious, or they have something constantly running in their mind. Then they tend to frequently blink their eyes. The thing is, if the eyes are extremely dry, now say if your child is somebody who has a long screen time, wherein they're constantly staring at the screen and then they don't blink their eyes, or if they're constantly exposed to a lot of dry air and wind while playing, then the eyes tend to become very dry and then they blink their eyes more frequently. Sometimes this can also be associated with the kids, constantly rubbing their eyes or watering from their eyes. Kids who also have some sort of an allergy, it could either be allergy to dust or to pollen, they also have this habit of frequently blinking their eyes. It's a body's natural way to try and remove the allergen from the eyes. Okay, so along with that, they will also have a little bit of redness and watering and constant urge to, rub their eyes. Or if your kid is having some sort of an eye strain, especially kids who spend long hours in front of the TV or using their phone or other gadgets, then such kids will also experience frequent blinking of their eyes and a lot of eye pain and eye strain. So as parents, what do I want you to do? One is observe the child. See if the child is constantly been doing it, or if it is just once in a while when the child is a little stressed out or anxious, or there is something triggering the child. And also when the child is doing, don't keep commenting on it, because then they become too conscious about it and then they do it more frequently. So watch them, but not always comment in front of them, because that is also not correct. Also make sure you reduce their screen time. Make sure that they take frequent breaks while looking at the screen. Also make sure that once they come back home, they clean their face, their eyes, and if possible even their body, so that some sort of an allergy, everything can be reduced. Also make sure that if dryness is the cause, then you use a humidifier, or you can also use a mild lubricating eye drop. But then again, I don't want you to delay. Now, in case if you notice that the blinking has been persistent, it's been there for a couple of weeks, and if you see that the child is complaining of constant pain, burning sensation and extensive redness, and the child is squeezing his eyes or squinting his eyes while seeing images, then immediately consult an ophthalmologist and the adequate treatment has to be given to your child. Okay, so think about it. Take care.